Yeah, so that's a very, very common question on people's minds because people hear the term thrown
Mm.
around and it can cause a bit of anxiety not to know exactly what it means. So, glaucoma, in the purest definition, is a typical type of damage to the optic nerve or the cable at the back of the eye that takes the messages to the brain, where there's structural thinning, and then it results in changes in the side or peripheral vision. The patients start to get changes in the field of vision. If left unchecked, undiagnosed, untreated, it can even come and take away the central vision. People don't feel this happening. The reason, well, one of the main reasons or one of the main modifiable factors in glaucoma is the ocular pressure. So the eye, just use my little eye model here, has a system in it whereby fluid is produced in the middle part. It percolates through the pupil and then it gets drained in this gutter over here that goes all the way around. And there's a little spongy organ at the base called the trabecular meshwork, which drains it. And the pressure goes up in the eye because of under drainage through the trabecular meshwork. And hence why there's a mismatch, the pressure goes up and damage starts happening. The trouble is when the pressure goes up to abnormal levels that cause damage, it's not symptomatic. So the upper limit of normal for normal humans is 22 millimeters mercury. And humans don't usually feel unless the pressure gets up to 40, so twice as much. And even then, if it happens slowly and insidiously, people don't even feel that. So that's why it's called the silent thief of sight, because the pressure goes up without you knowing it unless you're getting checked. And then that structural disc damage happens. And if left unchecked and untreated, then it can then start to affect the side vision.
So glaucoma, when it's quite advanced, is where you'll start to lose that peripheral vision. Is that right?
That's right. So advanced glaucoma really is when you're losing a little bit more of that peripheral vision and it's closing in. And hopefully we're over the age where people present with what we call sort of tunnel vision with only a small amount of vision left now because there's such good screening by the optometry community and optometrists are so accessible and people have good long-term relationships with them. The family has a good relationship with them. So then people are getting to us sooner and earlier on in the piece than before.
And are there any sort of common misconceptions about glaucoma that you hear from patients?
Absolutely. Well, I wouldn't say it's a misconception. I would say it's probably a genuine concern, but the risk of it is extremely low. So when I diagnose a patient with glaucoma, it's often a little bit emotional. And the first reaction that the patient says is, am I going to go blind, doctor? And I say this because even my own uncle, I was diagnosed with glaucoma. And when I was talking to him, the first thing he said to me is, am I going to go blind? And so it's important to realize that while glaucoma is a serious condition and it can cause irreversible blindness, the number of people that actually go blind from it is still small with modern detection and modern treatment. So, and not only that, depending on your genetic milieu, some people have a more, I like to call it a piddly glaucoma, so not one that necessarily progresses a lot or damages the nerve. And some people have a more aggressive glaucoma, which progresses really quickly, damages the nerve quickly, takes the vision away quickly. And at present, it's difficult for us to know which one is which, and we kind of have to use time to learn about each patient's disease. So I would say that's the biggest misconception. And based on the current literature, it's sort of the worst 10% that are most likely to go blind from glaucoma. There is a group in the middle between sort of 60 to 80% of the more severe types that are at risk of getting visual disability. So, for example, having patches in their vision, not being able to read clearly, or not having a wide enough visual field with both eyes open to legally maintain a driver's license. So I always tell people that in this day and age, if you've been diagnosed early, you're very unlikely to go blind unless you disappear into the bush and don't contact anyone.
So I think like maybe a lot of people know about cataracts and that they know that there are, procedures, surgical procedures that can actually address that, whereas glaucoma is quite different, isn't it? In the sense that once the damage is done, it's done. So it's really all about
Course is
prevention, right?
golden.
Yeah. Yeah.
Absolutely. Yeah. So this is what I talk to patients about the first time they come and see me, and sometimes even through their treatment, that it's better to err on the side of caution and do more screening, more prophylaxis, and rather than wait for things to declare themselves. Sometimes I sort of have a gut feeling that based on the assessment and the things we've got, that we need to escalate treatment, whether it's add a new drop or go for a minimally invasive surgery or go for a laser or go a more to a more significant drainage
Mm.
surgery. Sometimes the patients hesitate, and I can understand that, because it's a little bit like diabetes in that you don't know that the blood sugars are going up, but it's still doing damage on the inside.
Mm.
So glaucoma is
Mm.
the same. The blood pressure, the eye pressure rather, is going up and damage is happening. But the patient doesn't necessarily appreciate it until it gets very advanced. And so from that perspective, I think, yeah, people are less aware, and some people, because it's always a shared decision making, they take a
Mm.
bit more time than others to make that
Mm.
decision. But
Mm.
that's okay. And, you know, with modern technology, genetic testing, we are able to make better decisions, more personalized decisions, more accurate decisions to keep people from, you know, developing that visual disability or
Mm.
getting into that zone.